That's some of
That
the full animal.
okay.
Always withdraw the blood of the animal
Yes.
and then mix it with the medication and inject. It's a bad practice.
Hello viewers, welcome to Golden Media GH. Today we are going to tackle a crucial topic for anyone who works with cattle. And God being so good, we've gotten an expert who is going to take us through that topic. So our topic is cattle health. And this video is going to provide you with valuable insights and expert advice on how to take good care of cattle. So without wasting much time, I will introduce my guest to you. Boss, you are welcome to Golden Media GH. Please introduce yourself to my viewers.
Please, my name is Razak Asana.
Okay, please,
Veterinary personnel in Mampong here.
I'm sure to put your voice.
A veterinary personnel in Mampong here. I've worked with Mampong Municipal for about 6 years now.
Okay,
I was posted here in 2019 as a service personnel.
wow,
And from there, God being so good, I got maintained.
wow.
So I've been working with the municipal for about approximately 6 years now.
Wow, 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 wow. So, can you tell us what inspired you to come to this field?
Well, it's something I always talk without leaving one of my brother out.
Okay,
After senior high, I was like, I wanted to be a nurse.
okay,
So I applied nursing training and then veterinary. Veterinary was even one of my brother who applied for me. In fact, I didn't like the idea that I wanted to. And God being so good, the admission came before the nursing. I've gone to the interview, both the nursing and the veterinary.
okay,
And so the veterinary, the admission came before
the nursing. Okay,
In fact, I didn't like the idea of going there. So it was my auntie who was supposed to take care of me.
okay,
She singled out, took care of me from my tertiary throughout.
wow,
Wow. Before I say anything, I want to thank her for
yes,
that.
very important.
Gladys Anaba.
Gladys Anaba.
I pray that God continue to bless her.
Amen.
Well over the years.
Amen.
I would make her proud.
Amen.
She's a woman, she's a God in human form.
Wow, 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 wow.
But when I had the admission, I was feeling so reluctant to go. And she was like, well, if you wait for the nursing and then the admission come,
Okay,
you cater for yourself.
wow,
Though at that point, I didn't have an option.
Sure.
I thought maybe it was kind of a thing. They were pushing me to do something that I didn't like to do. So after going through and getting there, but I go to the school days later that I had admission to the nursing training.
wow.
But that day was really the bad day in my life. Well, what do you have to say? God knows why.
Sure.
It has up and down. Oh wow. So it was through that I was able to find myself in the veterinary college.
Wow.
And
This at where?
veterinary college, Tong Tamale, Animal Health and Production College.
Okay,
I completed 2019.
okay,
I came here as a service personnel.
wow,
And God being so good, I was maintained.
wow, wow.
Basically, to cut the story short, that is how the whole thing started.
Wow.
But in any case, I want to thank my brother and my mom, my dad,
Okay,
my aunt. In fact, she has helped me so good. Wow. For who I am today,
wow,
I wouldn't have been this vibrant working and without their help. Wow. So I want to thank them and tell them wherever they are, I appreciate their hard work. Wow. And may God bless them.
Okay, let's go to our topic. Today, we want to talk about cattle. So, cattle care. Want to know much about it. So, can you tell us something about cattle care?
That's okay.
Mm.
I want you to be specific. As in kind of diseases affecting
Yes,
cattle.
yes.
Yes, you see, sometimes the farmers, I don't really know what to say. But once you are here, we'll just talk about it.
Okay.
And I think we'll just talk basically from there going. And at the end of the day, you understand the point I'm coming from.
Yeah.
When you want to talk about some common diseases about cattle here,
Okay.
we have them
Okay.
Some few, though there are plenty diseases that affect cattle, but I want to be centered on the prevalence of some diseases here in Ghana. Okay. Things that we encounter most every day or mostly. Okay. We have a disease called brucellosis. In fact, it's a bacterial infection. Wow. It's caused by that issue. Wait, it's a disease. There's a disease we call brucellosis. Okay. In fact, it's a bacterial infection. It's caused by a bacteria called Brucella abortus. Wow. Today we are hearing so and it doesn't really kill the animal or that. Okay. But one thing about that disease is it's very contagious. Okay. And again, it's zoonotic. When I talk of zoonotic, it means that it's a disease that's able to move from human beings to animals or animals to human beings. Wow. And so when I also talk of contagious, it means that it's disease that's able to move either from human to human, okay, or animal to animal. Wow. You get it? Wow. But this disease has all these features. Okay. It's contagious, it's zoonotic. Wow. It means that the disease is able to move from the cattle to human beings. And it's able to move from human beings to cattle. Oh, okay. One sign that you could tell that your animal is suffering from brucellosis is abortion. Abortion. Okay. Your animal delivers and the baby dies all the time. It delivers and the baby dies. Okay. Okay. That is one clear sign, which means, okay, brucellosis. Okay. And so, especially women, when they're fond of getting in touch with those kind of cattle, they are likely to get the disease. Wow. And so they experience those stuff. Wow. And so it's an advice when a woman is there and then he begins to, or maybe you have cattle, or better say when you take the milk of that cattle, wow, you are likely, or that cow, let me be specific. If you take the milk of that cow, you are likely to get that bacteria in your system. Okay. And once you have it, these are some of the signs. It could also cause infertility in men and women also. It's one of the deadly diseases. Wow. Because it's zoonotic, it becomes very deadly. Wow. Wow. We can't also talk about cattle disease without talking the common diseases we all know. Yeah. The Fulani people will say, or no, the usual people will say is akumayare. Yeah. And we say is CBPP. Contagious bovine pneumonia. Okay. Say it again. Contagious pneumonia. Contagious pneumonia. Okay. It's a disease that affects the lungs of the cattle. Wow. And it's caused by a bacteria called mycoplasma. Okay. You get it? Okay. And that's the disease we usually call it yeah. That is CBPP. Okay. It's one of the deadly diseases that affect cattle. In fact, it will cost you about 50% loss of your production. Wow. And though it's not zoonotic, it's very contagious. Like I explained the meaning of contagious earlier. It means that once one gets it, the flock they are likely to get it. Okay. Because the mode of transmission, you could get it through droplets of respiratory droplets. It means when it breathes out the bacteria and it gets down, the other one goes through, then you can get it. Wow. You get it. Wow. That is CBP. Okay. One of the deadly diseases among the cattle flock. Okay. We also talk of anthrax disease. Okay. Anthrax disease, they say, wow, disease. The anthrax disease, you see, if I don't know if you follow headlines of late, there was this anthrax outbreak at the northern part. Is it my hometown specifically? Wow. Wow. Some people they had to quarantine some, ban the movement of cattle from Upper East to any part of the country. Wow. And it's also one of the deadly diseases, and it's also zoonotic. Okay. Once an animal gets this, and you as a human goes through it, you are also likely to get the disease. Okay. These are a few words. Okay.
What about this in the one that we call it sulfur? What is it?
Very good. That one is foot and mouth disease.
Okay.
We call it foot and mouth disease in simple terms.
Okay.
FMD.
Okay.
It's caused by viral infection, and it's funny how most of the farmers think that when you have FMD, there's a specific treatment for that.
Okay.
Anything viral doesn't really have a specific treatment. We just go with the symptoms. You treat based on the symptoms, and you are trying to build the immune system of the animal.
Okay.
You get it to withstand with the virus.
Wow.
But it is not bacteria where you say you have an antibiotic which you can easily inject, and it goes to maybe destroy the bacteria cells or kill the bacteria, and the bacteria is off from the animal system.
Okay.
When you have virus infection, you only manage the symptoms. Okay. So sometimes, like this, someone will come and tell me that he wants sulfur reactive. Then I'm like, wow, that is how we understand it. So, okay, it's normal. Okay. But I'm using this opportunity to tell the public that.
Okay. Then what tell them they are working?
I'm using this opportunity to tell the public that. Okay. But there's no specific treatment for virus infection.
Okay.
You get it?
Okay.
Not only FMD.
Okay.
But virus, anything virus, there's no specific treatment.
Okay.
You get it?
Okay.
So let's stop about this whole thing, make up software and other stuff, and and other stuff.
Okay.
There's no specific treatment for that. In fact, when you have that disease, what we advise you to do is that you try to build the immune system of the animal to be able to withstand it.
Okay.
How do you build the immune system? Okay. You supplement vitamins, and you also require to go in with.
So what are the signs of that foot and mouth disease?
The foot and mouth disease, you basically see wounds in the stomach, in the legs, in the hooves of the animal.
Okay.
You see wounds in the mouth.
Okay.
Sometimes the animals have ate a lot.
Okay.
That is get one kitten, and it's emaciated because of the wounds in the mouth. It's unable to eat.
Okay.
So the animal gets emaciated every day.
Okay.
And so what thing you need to do is to get vitamin. And because of the wounds, we recommend that you also use antibiotics.
Okay.
Probably some kind of penicillin.
Okay.
That contains protein penicillin. You know, penicillin is protein penicillin, which is very good for healing wounds and other stuff.
Okay.
So you use those stuff to be able, in case you would have secondary bacteria infection and other stuff. You know, because there's open wound, you could have bacteria invading the wound and all those stuff. So you try to build the immune system of the animal. Then you also try to prevent secondary bacterial infection through antibiotics like penicillin and other stuff. Okay. So basically, that is how I handle my foot and mouth disease. We also talk of lumpy skin disease.
Okay.
What is lumpy skin disease? Lumpy skin disease is also the same. It's caused by virus infection. Virus microorganisms.
Okay.
You see, of late we have plenty foot and mouth lumpy skin disease in Mampong.
Okay.
This disease is the mode of transmission. It could be mosquito bite.
Wow.
It could be a bite from these flies. Wow. They are the mode of transmission. They are the vector. Basically, they are vectors that transfer these kind of diseases. And so when you see the cattle, you see that they have these nodules. Okay. As in human, you have the whole pimples all over. Okay. And you have the
bruises. Okay.
So you have some kind of things like that. Okay. That is what we call lumpy skin disease. Wow. You see it all over the animal body. You have these nodules. You have pimples like this thing on the animal. Okay. That is what we term as lumpy. It's caused by virus. And like I explained earlier, we don't treat virus. So something like this, what do you intend to do? What we do is get straight based on the symptoms. You get it? Okay. In as much as you give vitamins, you try to also reduce that note of the inflammation. And that is where you are required to bring in anti-inflammatory drug like Dexa. Okay. And then also like antibiotics to prevent secondary bacterial infection and other stuff. Okay. You get it? Okay. So basically, I think we have many, and we also have a disease we call merge.
Merge. Okay.
Merge could cause by flies, distant lice, fleas, ticks, and other stuff. Wow. And more kind of you tell me that krusa.
Yeah. Yeah.
It's caused by ectoparasite.
Okay.
You get it?
Okay.
You have merge. The one good thing about merge is it's not really contagious, and it's not also zoonotic.
Okay.
So once you have the fleas, the lice in the or now the ticks around, you have many of you have the flock getting affected or maybe infected with that because they chop the skin. So they try to leave the damage there.
Okay.
And with that, like I said, it gets hypomic. Okay, that and everything is okay.
Okay.
Basically, these are some few diseases that whether you like it, I may have left some behind.
Yeah.
I can't probably mention or I'm talking of relevance whether you like it or not.
Okay. Okay.
So
okay. So now that we've known the diseases, we've seen the cause of those diseases. How do we treat them? As you mentioned earlier, if you can throw more light on it.
The treatment, in fact, like I said, treatment is something I don't want to actually bring on public. The ethics of my work.
Okay.
You get it?
Okay. It's not advisable.
It's not advisable to let out.
All right. All right. Okay. What is the right time for injection?
The right time for basically in the morning and in the evening.
Okay.
You get it? Okay. Whether you have to do vaccination, you want to do treatment.
Okay.
Let me even mention this. You see, the CBVP I mentioned earlier on, the foot and mouth disease, the anthrax.
Okay.
There's vaccination to get it this effective. Okay. In fact, very good aspect of the whole thing.
Okay.
You get it. Okay. So even with the CBVP, I advise that most farmers, there's a medication. I think a vial goes about less than 400 cedis.
Wow.
Where you can vaccinate up to 100 cattle. It takes a year for that vaccine to get out of the animal system. Wow. So probably when you vaccinate it, you wait for a period of 1 year and you will not have any CBPP case.
Okay.
Anything treatment costs. Okay. But when you wait and it gets to your farm, after now you are now running helter skelter to get some medications to and to your even with that you are likely to have some die.
Sure.
You get it. Sure. Why don't you do the simple thing? Just vaccinate them, and then
less than 500 cedis.
Less than 400 cattle.
Wow.
You get it.
Wow.
And sometimes people say, how do I use 500 cedis to buy maybe in 7 only 5 cattle? But you compare the prices of one cow to that 500 cedis. To that 500 cedis. You get it.
Yes.
And so please, farmers, I beg you to take note of these things.
Okay.
You get it. When you get your cattle, even if it is one, I don't think that the 500 is what your cow. Wow. You get it. Wow. You just get vaccinated and you are cool.
Okay. So the vaccines, the last thing you were telling me we have live and blah blah. If you can help my viewers.
The vaccines we have so many types, but I can only talk of two. For time factor.
Okay.
We have live antenated vaccine.
Okay.
When you talk of live antenated, it means the organism is alive. It is modified in a way that it cannot cause harm to the animal. Okay. Though there's this kind of replication, but it doesn't have, or it has been rendered ineffective, though it's alive. Okay. It can replicate and produce. Okay. This is what we call live antenated vaccine. And we also have inactivated vaccine. Okay. Inactivated is when the microorganism is killed. Okay. You get it. Okay. And use that to prepare vaccine. That is just the two types.
Okay. So what does the vaccine does in the animal system?
The vaccine, like I said, it prepares the animal system to fight against that disease in case it gets to. Okay. You see, like when you put in a vaccine to an animal system, it gives the system a signal. It gives the immune system signal. Okay. There's a foreign object in the in the animal system.
Okay.
Though at that point, the vaccine it doesn't really cause harm.
Okay.
But it gives a signal to the immune system of the animal or even human being.
Okay.
That there's a foreign object. So the body prepares itself to fight against that thing.
Okay.
So after preparing itself, realizes that it's foreign, and it is always so as and when the disease or the microorganism wants to get into the animal system, then already because the immune system of the animal is prepared against that specific microorganism, it gets it out from the animal system. That is how vaccine work. Vaccine doesn't really go to kill a disease, and when you have a disease, it's not advisable to vaccinate. Like you have Hep B.
Okay.
It's not advisable to go and vaccinate yourself against Hep B when you already have the disease. You get that right when you want to do Hep B, the first of all do test or confirm that there is no disease.
Wow.
Before they give you the vaccine.
Oh, okay.
This is how vaccines.
Wow. Okay, boss. Let's say I'm treating the foot and mouth diseases. How do I go by the administration of the injection? Let's say if I inject it today, then I wait maybe next month or next 2 months, I also inject it again. How do you go by that one?
Let me just use this advantage. I want to use this advantage.
Okay.
Talk about something we call microbial resistance.
Okay.
You get it?
Okay.
Microbial resistance.
Wow.
As much as I want to do the treatment aspect, I think you are trying to push me in there. You get it? Let me try and then educate the farmers on a certain aspect of these things.
Okay.
You see, when you go to hospital and you have malaria, and the doctor prescribes malaria drug for you, he asks that you make sure you complete your dosage. I don't know if that will count.
Yes.
There's a reason to that.
Yes.
You get it?
Sometimes they will ask you to come maybe the following week for a review
and other stuff.
Okay.
You can't go with one dosage.
Okay.
And you expect that your health is the microorganisms will be gone or whatsoever is causing your issue to be taken care of. Okay. You get it?
Yes, I get it.
The reason I say I want to use this opportunity to talk about microbial resistance is some people go Ajura, even traveling a distance, bringing in a kettle, and once they get here, they just go with antibiotics. Yes, they grab the amount. Please, it's not advisable.
Okay.
You get it?
Okay.
If you are doing that way, that's misuse of antibiotics.
Okay.
And it could lead to microbial resistance. And that is where someone would have an issue at the farm, say CBPP.
Okay.
Before you have asked your questions and finished, you realize that the farmer has done his own things, and now it is beyond him, and he's looking out for the vet personnel. Okay. And when you go there at the vet personnel, you are able to control that issue, then they tag you incompetent. Please, let's resist from this. It's not going to help us. Okay. When you introduce so much antibiotics into the animal system, the animal might develop microbial resistance. It might develop resistance to the drugs.
Okay.
And so at a point where you have very severe issues, even the vet personnel cannot perform the magic. Okay.
Wow.
You get it. Yeah. And so even with the foot and mouth diseases, if you want to like the question you asked, you are taking medication and then you want to go with once. Okay. He's looking at how much he has used to purchase the medication. Okay. Maybe the cases are five. Okay. So if I want to do repetition, it will cost me. Then I'll just. And so he wants to go once. Okay. When he can increase it, you get it. In fact, okay. You get it. Okay. You need to basically repeat the treatment. Okay. Maybe 3 days interval. Most of the medication is 3 days antibiotics and 3 days interval. Okay. You get it. You do and you wait
3 days time.
3 days and some 24 hours. Wow. You get it. Okay. The injectable mostly is usually I think 3 days. Wow. And so there's no any sickness that I think you will use one dosage of medication that will go. Okay, you get it. Okay, you need to repeat some of the depending on the medication you are using. Some 24 hours, some 3 days. Okay. And now dosage is one of the very important in cattle farming.
Okay.
You might be using same medication to treat the disease will not go.
Okay.
A personnel or a vet personnel will come and same medication the disease will go.
Okay. What is the secret?
It's either you are doing underdosage.
Okay.
Or you probably don't follow the routine or the route of injection.
Okay. Okay.
So we have 3 routine of injection.
Okay.
We have the intramucosal,
okay,
the subcut, and we have the intravenous.
And so can you explain that one to us?
Some farmers, I was here and then one of my butchers came to me and said he's full of animal.
Okay.
He has some cattle.
Okay.
Always withdraw medication, blood.
Yes, that one I've used seen some
direct.
Yeah.
And then mix it with the medication and inject.
Yeah.
It's a bad practice.
Wow.
You get it.
Please repeat that question again, because
that's some of the full animals.
Okay.
Always withdraw the blood of the animal.
Yes.
And then mix it with the medication and inject.
Okay.
These are bad practices.
Wow.
In fact, the animal welfare, there's something called animal welfare. It doesn't really work.
Okay.
If it is
outside,
up there, you'll be dealt with.
Wow.
You get it. When you look at most of the medication, some basically design intramuscles. Okay. It means that the route of injection is intramuscles.
Okay, so through the muscles.
That's injectable through deep muscles.
Okay.
Some say intravenous. Intravenous, usually we use it when it is an emergency cases.
Okay.
Where we are required for drip and other stuff.
Wow.
You get it? Wow. And the advantage of that thing is that the drug works directly. The moment you put in the medication, then it begins to work. Wow. Intramuscles take a bit of time.
Okay.
And in the case where you are using veins,
okay,
like what the full animal men have been doing, the animal could collapse.
Yes.
You get it?
They once told me that even there are certain places on the neck, if you mistakenly inject that place, the animal will die. That's what I heard.
So even there are so many places.
Okay.
Some could even paralyze the animal. Because I haven't seen maybe we have cyanotic nerves and other stuff.
So that's
when your needle passes through that place, then the animal gets paralyzed.
Okay.
And it's a bad practice, please.
Okay.
Let's go with the prescription of the medication. If nothing at all, you are trying to follow the right thing. And so if nobody knows tomorrow, if in case tomorrow you have a bigger problem at your farm and the vet person here comes there, things become easy.
Okay.
I won't be happy to come to your farms at your own how do I use the word? At your own mistakes. I am that incompetent. There's no single vet who is incompetent. The person has gone through the process, gone through the training, and have been satisfied. Okay. You get it?
Yes,
it is from the farmers that makes us incompetent. Okay. Please, you get it? Okay.
To continue with that. Will you continue that the full animal and then continue for
he said the full animal usually withdraw the blood. Okay. From you withdraw the blood and mix with the drug. Okay. And he was even asking me if I can do that. It's normal.
Wow.
It's normal, but please, it's a bad practice.
Okay.
I only do that when it's an emergency case. Where it requires life saving. You are required to put the animal on drip. Okay. Last time I put dog on drip and someone was like, Nakama is ready. All those things we do.
Okay.
You get it?
Okay.
And so it's an advice to the farmers and do those kind of injections. Okay. I think most of the injections here or the antibiotics is intramuscular.
Okay.
So the intravenous, like I said, only this drug you are required to go with subcut.
Okay, that one.
So subcut is when you single out raise the skin this way, then you put a needle in. Okay. Is this drug that we can use for subcut?
Okay.
Basically, when you even look at
so that's the ivermectin. Okay. Okay.
And so and anything ivermectin is this drug is control ectoparasite and endoparasite. The ectoparasite are the lice, the ticks,
Okay.
the fleas,
Okay.
and the endoparasite is the tapeworm, the roundworm, and other stuff.
Okay.
And this one control. And it's also treat the merge case that I explained earlier.
Oh, okay.
So the nature of this drug is very painful.
Okay.
Sometimes the manufacturer consider the painful of the drug. When you go intramuscles, it pains more than subcut.
Okay.
And when you go veins,
it pains more than
the intramuscles.
Okay.
You get it.
Okay.
And this drug is very painful. And so if you go intramuscles, the animal can easily collapse.
Wow.
You get it.
Wow.
Wow. So they have reason for indicating each with routine or route of injection.
Okay.
And so why do we have to change their method?
Okay. Okay, boss. Dewormer, or you deworming the animal, how important is it as a farmer?
It's very, very important. Worms can cause something we call cysts. And aside that, worms, there's this kind of competition with nutrients.
Okay.
You get it?
Okay.
You take in the worms, they are living things.
Okay.
They require nutrients to grow.
Wow.
They are in your system.
Okay.
And so basically their source of nutrients is from your nutrients.
Wow.
You get it?
Okay.
So there's this kind of competition with nutrients. Worms can cause your animal to grow emaciated.
Okay.
Though eating some worms will cause your animal to actually lose appetite.
Wow.
Some probably might not cause
the emaciating, people don't understand. So they'll be eating and then
they'll be growing lean.
Okay.
You get it?
Okay. Okay.
Alright. They are eating alright. And there's this kind of competition with nutrients that is going on.
Okay.
Because the worms also require nutrients to grow.
Okay.
They are living things.
Wow.
You get it?
Okay. So how many times am I supposed to deworm my animal?
Basically, I think every 3 months you should be able, if nothing at all, every 3 months you should be able to deworm your cattle.
Okay. Okay.
Every 3 months.
Okay. Okay. Let's still go back to the injection. What's the right place for injection?
Like I said, I've explained that the right place for injection is, let's just even rule out the intravenous because it's for professionals.
Sure.
You get it? But a layman could go with the subcut and then the intramural.
By exact places on the exact side.
Yes. We have here you can locate the thigh muscles.
Okay.
Usually I prefer to go here, the thigh.
Okay.
You get the muscles there.
Okay.
These are against my way.
Okay.
You go, okay, I get it. Okay. You can go with the thigh. If you are going with the thing is that when you are going to use a drug that is for intramuscles, all that you are trying to locate is to locate muscle.
Okay.
You get it? It doesn't really matter where exactly, but the most important thing is to locate the animal muscle.
Okay.
You get it?
Okay.
And so when you are also using subcut, the most important thing is to locate, is to get the drug under the skin.
Okay.
So it doesn't matter. Even subcut, you can do it here. You can do it here if only you can raise the skin and put the drug under.
Okay.
You get it?
So I need 5 essential drugs if I'm a farmer that I should have in my farms.
Yeah, like I said,
5 essential drugs. That is very important in case of maybe you don't have money and emergency times. You just call your vet. And your vet too is also busy. You know, vet, you are very
we are very scared.
Yes.
We are very scared. In fact, when I got up this morning, I've left home today. Is Sunday. I have not even gone. I have not gone to church. I've left home about. I had to wake up to do somebody's call.
Wow.
And sometimes let me use this one. When someone call you and you are kind of busy, we are not plenty in the system.
Okay. Please tell them there.
We are not plenty in the system.
Okay.
I think some people are capitalizing on that opportunity.
Okay.
To do their own thing. You get it? We are not plenty in the system, and sometimes imagine the whole of Mampong, which contains about 40-something communities.
Yes.
We are not really plenty. About 4 or 5 of us.
Wow.
And so how getting up, someone calling you from this place and this place, you could get up the whole day and you are kind of engaged.
Wow.
You get it? Wow. And so all fair, then it gets something called prophylaxis. Okay. You have to pre-arrange or maybe pre-inform us about it.
Okay.
When I say prophylaxis, it's when you assume that your animal is exposed to certain microorganisms.
Okay.
You get it. So
Okay.
you want to go with that kind of treatment.
Okay.
You get it.
Okay. Okay.
That is prophylaxis.
Okay.
You get that. It is when it becomes very emergency. Maybe you have some kind of a car knocked, or maybe a critical condition or something. Just all this sudden that you can really give out that pressure. It's understandable.
Okay.
You get it.
I get it. So 5 help us with 5. Cameraman, please come inside. So you show us those drugs.
With
5
those 5
essential drugs.
medications. Let me explain something here.
Okay.
I think you do have that question, but you see, this drug,
Okay.
it's a vitamin. It's vitamin.
Okay.
This one is also vitamin.
Okay.
So this one is also vitamin.
Okay.
There's difference between
The 3.
the three.
Okay.
These two belong to the same category.
Okay.
This one is Bicovit.
Bicovit. So
And this one is
Bicovit. Okay.
and this one is multi-B complex.
Okay.
So anything B means that it contains only the B vitamins.
Okay.
Vitamin B, vitamin 2, vitamin B2, B3,
Okay.
and so on. That's the B12.
Okay.
You get it.
Okay.
This is multivita.
Okay. Multivita.
Vita.
Okay.
So the name multivita means it contains all the essential nutrients, contain all the the minerals and other stuff.
Okay.
The purpose of this is for nerves, nerve function.
Next.
When your animal is going depression, you actually require it, and it's also for energy.
But they are not paying school fees. They don't have broken hearts. Why should they go?
An infection can make an animal. It doesn't really matter if maybe psychological or kind of this thing.
Okay.
But an infection could lead you to thinking. Wow, you get it.
Okay.
So this, when your animal is kind of lacking energy,
Okay.
you are requiring B complex.
Okay. Okay.
Mekano, obina FM,
Guys, as you can see, so you forgive us.
And so this is for energy. Someone will come and like, I'm buying vitamin. In fact, you need to really interrogate, ask questions. The reason he's buying vitamins.
Okay.
You get it.
Okay.
If to maybe kind of replace certain minerals, and you come and buy Bigo, you are not using it for the intended purpose.
Okay.
You get it.
Okay.
This one is to boost the immune boost the energy level of the animal system.
Wow.
This one is for replacement of nutrients, as in minerals and other stuff, or vitamin deficiencies and other stuff.
Wow.
You get it.
Wow.
And so usually when you have cases where the animal is weak and you are required to use antibiotics, you probably will be needing B complex, not multivitamin.
Wow.
You get it.
Wow.
Okay.
Okay. Okay. Okay.
And so this B complex, B COVID, this is multi-B complex.
Okay.
I think
So that's 1. You're giving us 1. We want 5.
This is dexamethasone.
Dexamethasone.
If you like, M-dexa.
Okay. M-dexa.
This is an anti-inflammatory drug. It means that it works against all inflammations.
Okay.
It's also for pain relief.
Okay.
When you have this kind of inflammation in your animal, maybe compound banana disease, you probably require this. And it's something that you cannot do without. Even when you bring your animal from a distance, this is the required drug. Please stop using menono and other stuff.
Okay, let's chip in, then we continue from there. So new arrival
of kettle. This is the medication you like to use. You probably will use this one and the B complex.
Okay, so the first day you bring it from.
Let me explain something.
Okay,
assuming you are bringing a cow from the northern part, because of the distance, it probably will be in the cow for about 12 hours.
Yes,
it will not eat.
Yes,
because you have tied it on the car. It probably will be going through kind of pain. You need this.
Okay, that's the M-dexa or Dexa. Okay, the Dexa
for reducing pain. Inflammation cases and a whole lot. Even if your animal after delivering, people go with menoma and other stuff. No, this is the drug you need, and the drug. When your animal delivers, because they have to use energy to push in the baby. Probably through labor, people get there is painful and other stuff. You try to use the MDEX to reduce the pain. The B complex would give the animal energy.
Wow.
You get it?
Wow.
These are the two medications you need when your animal gives birth.
Wow.
It is not when giving birth you are now looking for antibiotic, unless maybe during the birth there's this kind of wound around, or maybe kind of leading to an open wound, where you will be like, okay, probably when you say a bit leading some secondary bacterial infections, when you say maybe antibiotics, but ideally, there's nothing wrong. These are the medication.
Wow. So when they after delivery, you are supposed to give them drugs.
When they give birth, you are supposed to give Dexa.
Wow. And you don't know. So that farmers don't know. So when they after birth, then you need it.
You don't know.
Wow.
You get it?
Yes.
These are animals that really don't talk. So if it's even on pain, you won't know.
Sure.
You get it?
Wow.
So these are the medication that is required.
Okay.
Maybe bringing an animal from a distance,
or probably so when do we after the MDEX and the B complex, when do we inject the pencil that we used to?
The pencil is when you have a case at your farm. The menono.
Okay.
So you don't with anything antibiotics. It is good when you have a case, you get a professional person.
Okay.
He diagnoses the case and tell you this is the problem with your animal before and recommend a drug.
Wow.
Even human medication drugs.
Okay.
You don't go to the shop and buy antibiotics when it is not prescribed.
Wow.
It's a prescription drug.
Wow.
You get it.
Wow.
It is when you have cases that you are required to.
Okay.
You get it.
Okay. Okay.
Wow.
So we got in that one. So now we have the no and then the B complex. So 5. Yes.
And then you can also do without spray.
Wow.
This is for wounds.
Okay.
All this spray, we in simple sense, they contain antibiotics.
Okay.
All this tetracycline.
Wow.
And it is used for open wound.
Okay.
And when there's a cut in your wound, this is what you use. You shake it well, then you drop it in.
Wow.
You get it out. Wow. And these are something that you cannot.
Okay.
And then you can also do, when you bring in your animal, at least 3 to 4 days, try to deworm it.
Okay.
You are going to the market to buy the animal. You really don't know the farmer that sells the animals to you.
Okay.
You can't get the history of the animal. You have to start your own history.
Okay.
You get it?
Okay.
If the farmer didn't really deworm it, you wouldn't know that they didn't deworm it.
Okay. Yes.
And so, try to deworm it 3 days after.
Okay.
Your deworming.
Okay.
And mind you, people who bring in animals and they start injecting these antibiotics, these painful medication, ivomic and other stuff, it even gives the animal more side effects alone is more than this thing.
Wow.
You get it?
Okay.
So the side effects sometimes it's even more severe than the disease itself. But because they are unable to talk. You get it?
Okay.
That's why what the animal goes through, you don't care. You don't really. Not that you don't care. You don't know, because if you care, if you know what is going through, you definitely care for.
Okay.
You get it? Okay. And so 3 days later, after bringing your animal, try to deworm it.
Okay.
And then you take your history from that end.
Okay.
You get it?
Okay.
Then you have your history, your record book.
Okay.
Know that this particular day I had dewormed.
Okay.
In fact, anything livestock, it's very good.
Okay.
You can talk of the poultry. You can talk of the cattle.
Okay.
You can talk of the small ruminant. That's the goat sheep. It's very good depending on how you are bringing them or how you are managing things.
Okay.
Around your farm.
Okay.
Mind you, when you bring in animals from a distance, where you already have a flock in your house.
Okay.
Maybe you have cattle in your house. You go to Ajura to buy cattle.
Okay.
When you come, you don't allow them to mix.
Wow.
You quarantine them.
Okay.
For a period of 2 weeks, advisable. 2 weeks. There's something we call incubation period of disease.
Okay.
That is when you had the disease to when the disease begin to show symptoms.
Okay.
You get it?
Okay.
Probably the animal get infected. There's this kind of CBP. Market.
Yeah.
People bring in sick animals.
Sure.
And a whole lot.
Sure.
Maybe there's this respiratory droplet down there. The animal has gone to a hill. They are picking microorganisms already.
Okay.
They are picking the CBP case. I'm using that as an example. Yeah. So when you are bringing it, you probably that day it wouldn't show symptoms. It takes a period of time for the microorganism to replicate and then begins to work against the immune system of the animal.
Okay.
And so usually the immune system is made in such that when there's a disease, it begins to fight it on its own. The white blood cells.
Okay.
The white blood cells begin to fight the disease on its own. Wow. It is when the disease is getting more, how do I put it? It's overthrowing the white blood cells. That is where you begin to feel like I have headache, I have this, I have this.
Okay.
You get it? Okay. One thing I want you to know, every day we have diseases. Even the food you eat, they are contaminated food and a whole lot of that. The immune system of ourselves is able to fight them. That is why we don't see symptoms.
Wow.
You get it? Wow. And so when you are bringing in animals from afar, probably because of this, like I said, incubation period, the animal might pick microorganism or some pathogen alongside. Pathogen is microorganism that is able to cause the disease. Okay. That is what we call pathogen. Wow. And so, you have to give it a period of 2 weeks. Okay. Probably if there's a disease or if there's this kind of infection taking over place within that period of 2 weeks, there are two things involved. Okay. It's either the immune system is able to get the disease down, you wouldn't even see any symptoms or signs. Okay. Or the disease is able to get the animal down. Wow. Wow. Okay. So if at that point you have not noticed it and you've gone to add your kettle to the other flock, and there's also a respiratory droplet, maybe you are sneezing, now it goes to the other ones. You have indirectly transferred into the microorganism to now the pathogen to the your flock. Wow. And so as and when the animal begin to show signs of sickness, and the rest of your flock too also begin to show symptoms. Okay. You get it. Okay. So quarantine is important thing. Wow. So I think so that is all. Okay.
Then we've gotten 3: Dexa and Biko, Dewormer, and that's the most important thing.
That's the most important thing.
What about Tylosin?
Tylosin, you would have it at your farm, but not use it. Okay. Like you said, instances where you are calling a vet and you don't get him. This is where you are required to. Okay. Maybe you call the vet and you explain to him your problem. Yes. You get it? Yes. We have something we call differential diagnosis and tentative diagnosis. Okay. There is tentative diagnosis. He suspects a certain disease. Okay. Maybe it's respiratory diseases. And maybe it's a CBPP. Okay. Then he asks you whether you have Tylosin. That is where you are required to use Tylosin. Okay. And even let me highlight on that disease. That Akumayari disease. People get scammed and buying Akumayari drug. Okay. And they will go, it will not go. I will go and it will go. Why is the difference? Okay, you are on the field. The issue is that you see, when the microorganism gets into your lungs, it causes damage to your lungs. Okay. You would have your lungs being inflamed. Okay. You get it. Okay. And this drug is for taking care of the microorganism. It's taking care of the microorganism that brought in the inflammation, the damage to your lungs. Okay. You get it. Okay. Oh no, lungs or air lungs. But it has already caused damage. Okay. This one will take care of the microorganism. Okay. So after taking the microorganism, what else? You will have the lungs stay inflamed. Okay. That is where Dexa comes in. Wow. You get it? Yes. That is now when you go to the hospital and you are like, you have malaria. Someone, maybe the malaria has caused you not to eat. Okay. And so he gives you this thing. He gives you malaria medication and he gives you what is the name? Vitamins. Maybe the malaria is causing severe pain. He gives you the malaria medication, then he gives you paracetamol. Okay, you get it. Okay, I get it. The paracetamol will help reduce your pain. the malaria medication goes to kill the parasites.
Oh, okay. I see.
This goes to kill the pathogen.
Okay.
This works by reducing the inflamed lungs.
Okay.
There are instances that even with the tyrosine alone, the microorganism is gone, but you still have the animal coughing.
Okay.
You get it?
Yes.
And you think that but it's because the lungs are inflamed earlier. You are really not taking care of the inflammation aspect of the lungs. You are only concerned of the pathogen.
Wow.
You get it?
Wow.
Wow. Wow. And so once you have this and the tyrosine, prevalence of CBP is one of the prevalence of disease.
Okay.
In fact, the most common one disease here. Yeah. Yes. So your vet may recommend that give it tyrosine and Dexa.
Okay.
You get it?
Okay. So we have 4. Last one.
Oh, the last one is something that it's when maybe it's antibiotics.
Okay.
You get it?
Okay.
And the reason I said is something that you probably might not. It is when all the medications are available. It's when maybe the only thing you can use is the Deworming, the Dexa, the spray, the B complex, and the tyrosine. That's the B5. But the rest of the medication, you are required to seek professional advice from the vet.
Okay.
You could have it at your farms.
Okay.
At your disposal.
Okay.
As and when maybe probably Sundays, many shops don't open. Okay. So if you have an emergency case where you are required to use those medication, the shops are not open.
Okay.
You get it?
Yes.
For that purposes, you can have it at your farms.
Okay.
Where we have the LA.
Okay.
It's a wide bacteria drug. Treat a wide range of bacterial infections.
Okay.
You get it?
Okay. Okay.
Like this drug I was talking about, the brucellosis, is one of the drugs that is good for the brucellosis. Because it's caused by bacteria. Okay. So heavy dose of this, you are taking care of the brucellosis.
Okay. Wow.
You get it?
Okay. How is it tetra? Tetravit. Okay.
Wow. We also have, this is iron injection.
Iron. Okay.
We are dealing with cattle. Mostly it's good for piglets.
Okay.
I don't say piglets, those small. Okay. 3 days after delivering them. Wow. You give them it's amoyadro.
Okay.
Wow. When you suspect your animal is anemic.
Anemic.
That one too.
Explain to our level. Yes.
Anemic is when there's no blood in the animal system.
Wow.
Then
We give you
you are
this.
required to use this.
Wow. Boss, I'm doing.
This one you have M-sulfur.
M-sulfur.
Okay. This is for diarrhea cases.
Okay.
In fact, sometimes you use even all this tetracycline to handle diarrhea case, depending on what is causing diarrhea.
Okay.
You could have worm causing diarrhea.
Okay.
You could have bacterial infection causing diarrhea. You could have virus infection causing diarrhea.
Wow.
You could have protozoa causing diarrhea.
Wow.
Depending on which one is causing the diarrhea, if you're able to detect that, okay, my diarrhea is as a result of bacterial infection. In fact, any of the bacteria by antibiotics, you use it. It will take care of it.
Okay.
But if your diarrhea is caused by worms and you are using antibiotics, it will not go.
Oh, okay.
You get it? Okay. Unless you get a dewormer.
Wow.
If your worm is caused by protozoa, fine. This is where sulfur comes in.
Wow.
So it has both the protozoa ingredients and other stuff. So it's able to take care of parasitic and this thing. You get it? Okay. That's why it's most recommended for diarrhea cases.
Okay. M-sulfur. Okay.
Wow. Anything sulfur. You see, when you look at the poultry side, I have them here. The sulfur show.
Okay.
In poultry, we use it to treat cocci cases.
Okay.
Cocci is parasitic infections.
Wow.
I have them. Oh, in fact, this is one sulfur product.
Okay.
In fact, very good product.
Okay.
In town.
Wow.
Very, very, very good.
Wow.
Coxen fort powder.
Wow.
For poultry.
Okay.
Because I interfere with egg production.
Okay.
If your birds are laying, you don't use it because it interfere with egg formation.
Wow.
The follicles and other stuff.
Wow.
So when you have it, when you are using it when your animals are laying, you are likely to have a reduction in egg production.
Okay.
You get it? Okay. I think you have to get time and camera.
Sure. We take more good for poultry. Sure. That one
is that is of interest.
Yes.
Many farmers are here to poultry. Yes.
Boss, what of snake bites? How do we treat snake bites?
Snake bites.
Yes.
by snake bite. There's this poison this time. But usually when I have what is the name? I've really forgotten. But usually when I have snake bite, I go with Kenslip and Dexa.
Okay.
Next time you have to make time to come and then
Yes.
actually do a break.
Okay. Okay.
And that has to do with commercial business.
Wow. So can you give us your number if someone wants to call for more education? You know, we have a lot of questions that we couldn't ask.
In fact, let them know any power who calls, I will charge for that.
That one there.
Another is 055
055
054
054
89
89
54.
54. Okay. Then thank you for spending this hours with us. May God richly bless
You're
you.
welcome.
And God bless you. Guys, here is where we're going to end our conversation. There is a lot of questions that you could have asked, but due to time factor, we are going to end this video here. Please, if you found this video helpful, please just like it and share it. And then don't forget to also comment. May God bless you all. Till we meet again. Bye bye.